I think patients have need to be much more central in designing their own care, insofar as they want to be. So, I mean, there are lots of arguments for it. We know that care is getting more and more specialised and therefore more and more fragmented. That's how patients see it. We know that that most people actually do want to do whatever they can to help themselves. And so actually helping them to see themselves as kind of co-producers or co-managers of their care is what professionals, what clinicians ought to be trying to do. Confidence. Actually believing that their views, their experiences are important. And that means for clinicians, it means they must stop undermining patients by implying that they and only they have all the answers. Professionals are rather bad at informing patients or signposting good sources of information. They do tend to talk in language often that's very hard for patients to understand, when actually you could describe most problems in everyday language that is more comprehensible. In those kinds of subtle ways, clinicians undermine patients' confidence to deal with their health. We can't go on delivering services in the kind of fragmented way that they're currently delivered. So patients, service users don't divide themselves up into chunks that are dealt with by different professionals. So we've got to become much more integrated, coordinated, holistic in the approach. Technology doesn't have to be sophisticated. I mean, one very important technology which has been underused in healthcare is the telephone. I hope that we'll be seeing many, many more opportunities for consultations to happen over the telephone. Clearly the internet is already making a huge difference. It means that there's very wide access to all sorts of sources of information. Some of them are reliable and useful, some of them are not. And so we're going to have to develop ways of helping people to distinguish one from the other. Patients are becoming, they're becoming more critical, which is a good thing, more sceptical really, more aware that not all healthcare is beneficial. Some of it, that there are harms as well as benefits to most medical interventions. That there's a great deal of uncertainty about what's best to be done for a particular problem. I hope they'll become more choosy, more selective, and I hope that they will be helped to make informed decisions about their care. There definitely is a demand among many for much greater involvement in the decisions that affect them.